Good afternoon, good morning, good evening, depending upon where you are. This is Chuck Friedman of the University of Michigan. I will be one of the two co-presenters on this webinar. Rachel Richesson is our other co-presenter this morning. My colleague in this effort. Rachel, would you like to say hello?
Yes, hello. Thank you, Chuck, and welcome everybody to the webinar. We're really looking forward to sharing with you our experience from this meeting. I'll pass it over to you, Chuck, to start, and then I'll pick up in a few minutes.
Okay, thanks, Rachel. So greetings again, everyone. We're delighted to be with you, and we will be talking about the movement, the incipient movement to mobilize computable biomedical knowledge. Today's webinar is primarily for those who missed the inaugural meeting on mobilizing computable biomedical knowledge, which took place at the National Library of Medicine in July. Those of you who were at that meeting are, of course, completely welcome today, but a primary purpose of today's webinar is to bring those who were not able to attend the July meeting or who discovered what this is about subsequent to that meeting, up to speed on what computable biomedical knowledge is, what it means, the community that is forming around this concept, and how it is going to move forward. The two major bullets on the slide in front of you are the topics that we will cover. I will cover the concept and importance of computable biomedical knowledge, which we will start referring to as CBK, and then Rachel will take over and talk about how we will move forward and actually are already moving forward from the July 2018 meeting. Our hope is to get through our two presentations in 35, maybe 40 minutes, leaving significant amount of time at the end of our two presentations for questions. We will be choosing the questions that you put forward on the chat board to address based on our perception of what questions will be of most interest to everyone on the webinar to cover during the hour. We are going to, since we know who has posed the questions and we believe we have everybody's email address, we will make every effort to get back to people who have posed questions with a response after the webinar as soon as we can. So if you pose a question and we don't get to it today, please do expect an email from us sometime soon. The jumping off point for the idea of computable biomedical knowledge is actually a higher level transcendent idea which most of you probably have heard about, which is this notion of a learning health system. As shown on this slide, a simple definition of a learning health system is one which has the ability to continually and routinely study and improve itself. This idea was originated by the Institute of Medicine, now the National Academy of Medicine, back in 2007, so it's been around for about a decade. And the NAM has put forth a very large number, 12 or 13 books and monographs about the learning health system, and I invite you to go to their website and partake of these resources, which are available online. There has also developed very recently, I'd say in the past 5 or 6 years, a considerable literature about learning health systems, and I will direct you here to one very influential article that was published in the New England Journal by Arnold Milstein where he came forward with the assertion that in order to safely limit healthcare's GDP footprint in the United States, one of the three things the nation needs to do is realize a learning health system. You can think about a learning health system more specifically as having the 5 characteristics listed on the slide, that records of health events are available to learn from, which very likely means they are in computable form, that best practice knowledge derived from analysis of these events it becomes immediately available to support choices and decisions, and actually it's this aspect of learning health systems that brings computable biomedical knowledge most profoundly into play. Learning health systems are also characterized by continuous improvement, the presence of an infrastructure that allows this routine activity, and also for it to occur with economy of scale. And finally, a learning health system, an organization that is a learning health system, will have this as part of its culture. So this is a cultural phenomenon very much, as well as a technological and policy one. The activities of learning health systems may be thought of as cyclical performance improvement processes that can be seen as occurring in 3 phases, beginning with studying what's happening now, taking performance of the current system to data, continuing with analysis of that data, making out of that data new knowledge, and then, very important, continuing the cycle by taking that knowledge and bringing it to practice to improve performance. All of this around an identified health problem. It's very important to recognize that the importance of these complete cycles that include both taking data to knowledge and knowledge to practice, and to have this occur in addition to the process that many of us, particularly those of us in academia, are accustomed to doing, taking data to knowledge and publishing it in journals, and then very often cycling back with a new data set, converting that to knowledge, and publishing that in a journal. The key point here relating to learning health systems is that we can't assume, if we publish new knowledge in journals, that someone else is going to be there to quickly take that knowledge and bring this to practice. Very often that isn't the case, and this, among other things, accounts for the well-documented latency between discovery of new biomedical knowledge and its widespread application in practice. Now, if you think about this learning cycle idea, which is fundamental to the learning health system, it becomes clear that a learning health system needs the ability to persist what it learns, so that the results of analyses can become a resource that informs practice. Without this, what we call keystone knowledge sitting at the top of the learning cycle, it could be very, very hard to take what is learned and put it into practice. So we talk about persistent knowledge as the keystone that holds this cycle together. If we have this keystone in place and the ability to persist knowledge, we can think about how we can take discovery systems which create new knowledge and by and large persist it only in journals, and make it into a learning system which can take the learning, take the new knowledge, and put it directly into practice. So let's talk about persistent knowledge a bit more. With some degree of boldness, because this has been a point of philosophical debate for millennia, we are offering a definition of knowledge that we believe will suffice for the purposes of this discussion and to carry forward this idea of computable biomedical knowledge, which I will get to in a moment. We can think of knowledge as the result of an analytical or deliberative process that holds significance for an identified community. If the knowledge is persistent, that means that some kind of explicit representation of the knowledge exists at any point in time. I want to be sure to emphasize that making knowledge persistent is not equivalent to making it static, because if the knowledge changes, then a new modified persistent representation of it can be made. Now, down on the bottom of this slide is the key jumping off point for what we are addressing here today. The idea that this persistent knowledge can be represented in two ways. One that has been with us for a very, very long time, and that is knowledge in human readable form, one example of which is a journal article. And the other, which is a relatively new idea, certainly compared to the length of time that human readable knowledge has been around, and that is the idea that that same knowledge can be represented in code, in machine executable forms, and we are going to use this representation, this concentric circular representation, as a way to depict what we will call a knowledge object, which is the machine executable representation of knowledge, which is often derivative from and often identical to, in terms of its content, its human readable analog. So expanding this idea, we can see that there are two complementary ways to represent knowledge. The present and the past, which is the representation in human readable words and pictures, and the repositories for this knowledge have traditionally been libraries, which hold this knowledge in the form of books and journals and other resources. The second, future-oriented representation of knowledge is knowledge in computable forms, where instead of in words and pictures, the knowledge itself is represented in code, which can be executed by computational machines. We don't think libraries are going to disappear. In fact, we're quite certain that libraries will not disappear, but we do believe that as this evolution to computable biomedical knowledge occurs, the holdings of libraries will, in addition to books and journals, add these digital knowledge objects. Now, I should point out that digitizing in the form of a PDF a journal article does not make that knowledge computable, because it is very, very difficult to compute on a PDF. What we're talking about with computable knowledge is knowledge where the actual payload
is revolutionizing healthcare and rapid advances in technology.
Somebody needs to go on mute. I'm sorry. Where the knowledge is represented in code. To further this example, the human readable knowledge, for example, in this published paper from the New England Journal of Medicine, is often expressed in a model. And when the knowledge is expressed in a statistical model, which is the case for many papers that are published today, we begin to get an intuitive idea of how this knowledge can be expressed in machine executable forms. When the knowledge is not expressed in a mathematical or statistical model like this, we need to be a bit more creative in our thinking about how to make the knowledge computable, but in many cases we believe this is still possible. So this leads us to the notion that perhaps in this world we are envisioning, which embraces knowledge in computable form as a complement to knowledge in human readable form, we need to think about the publication pipeline as not ending with the publication of an article in human readable words and pictures form, but rather continuing to create a complementary representation of that knowledge in computable form. And you can see that this would occur through two steps depicted on this slide. One, which is extraction of that aspect of the new knowledge expressed in the paper, which can be the kernel that is expressible as code, and then some programming, which, again, depending upon the nature of the knowledge, might be more or less intricate in nature, which would convert this table, in this case, to code, which executes the model, in this case, a logistic regression model, which is expressed in that table. The pipeline, which would lead to the human readable knowledge being curated and managed in traditional libraries, would result in these digital knowledge objects embracing and expressing the computable knowledge being curated and managed in the expanded libraries of the type that I was referring to before. Now, this idea is on the street. It's around, and I can point you not only for a discussion of this to the National Library of Medicine's strategic plan, which was issued last year, which very much includes expression of these ideas, but also to a very interesting article that was published in The Atlantic earlier this year called "The Scientific Paper is Obsolete," which expresses from a different angle, from a different approach, very much these same ideas. I think a lot of people are taking this idea of computable knowledge and projecting it to a use case which in many of our collective experiences it seems to directly apply, and that is to clinical decision support, and this is certainly a valid use case to which to apply this idea, and one that I think is very, very important. But at the same time, as we consider the concept of computable biomedical knowledge and learning health systems in its broadest sense of applicability, I think we can envision other use cases also very important that address research, as shown on this slide, public health applications, as shown on this slide, and education, as shown on this slide. So while computable biomedical knowledge is fundamental to taking clinical decision support to scale, we believe it is equally fundamental to taking many research, public health, and education use cases to scale as well. As I'm drawing to a close, another way to think about what we are seeking to do in the mobilizing computable biomedical knowledge movement is to apply the FAIR principles, which have been widely applied to data, and we speak frequently of the imperative of achieving data fairness, and applying them to knowledge. We believe it is just as important to make knowledge findable, accessible, interoperable, and reusable as it is to meet the same criteria for data. So perhaps a shorthand way of thinking about what this movement is achieving knowledge fairness as a complement to data fairness. And the approach to doing this can be seen as occurring in several stages as we can begin to think about what an ecosystem that supports knowledge fairness might look like. It certainly begins by taking knowledge artifacts of various sorts, which can include guidelines, articles, as we discussed, as well as local analytical results that many, if not most, health institutions are generating now through analyses of their own data, and making the models that are the products of these processes or published in these articles into knowledge objects that are computable with their payloads expressible as code. And then realizing, as I've mentioned earlier, next generation digital libraries that will be the entities whose mission is to curate, manage, and share this computable knowledge. And here you see a library whose holdings are not just books and journals, but also these computable digital objects. And then recognizing that we can conceive of a world where there is a knowledge ecosystem connecting these libraries, allowing them to share these digital objects, and really achieving fairness by making the world's knowledge accessible in computable form through these networks from any place at any time, subject to a number of policies, which, as Rachel is going to address very soon, that need to be put in place to govern this ecosystem. Okay, so that brings my comments to a close. Rachel, I'll turn this over to you, and you will talk about how we're going to move forward from here.
Terrific. Thanks so much, Chuck. And you did a great job setting the stage in describing the current state and future vision of this movement. And as you alluded to, that and is clear from your presentation, you've been obviously thinking about these issues for a long time, as are many of our colleagues on the line today. And so it's very exciting for me to be able to summarize the results of our first public meeting that grew as a result of many years of discussion related to these ideas. So this first public meeting, is very fitting that it was hosted by the National Library of Medicine, or it was held at the National Library of Medicine at the Lister Hill Center. Let me switch this slide here. We had a wonderful planning committee, and I'll list the members of the committee here for folks to read as I talk. This committee, we had 15 members that helped us plan this meeting, really helped shape the development of the meeting objectives and the content and the format, and also the outreach that we did. And members of our planning committee came from diverse backgrounds, including clinical medicine and nursing, library and information science, research and healthcare administration, and CDS and information providers, including federal government and folks in the commercial sector. The goals of the meeting were to strengthen this foundation and really develop a community around these values and principles for mobilizing CBK. We wanted to get people together from multiple perspectives and multiple stakeholder groups to frame and address the important dimensions for mobilizing CBK, and then to grow the committee and move towards some action. Specifically, we wanted the meeting to begin to develop some action plans around further community cohesion and collaboration and advancing us towards making biomedical knowledge, or CBK, fair. We wanted to identify priorities and plan some next steps. So our hope was to really bring us together and then also build some momentum that we might move forward on this. The meeting, again, I thank our planning committee that really helped shape this. It was a 2-day meeting, and some of the highlights are listed here. As I mentioned, it was a public meeting. We tried to advertise it on as many listservs and to as many communities as we thought were interested in this, and we had over 150 people attend, but certainly as people are listening to the background and the benefits of this, there's certainly many more stakeholders and folks to engage in this movement moving forward. But we did have 150 people, and we tried to pull them together on some common ground. So our attendees represented clinical and public health sectors, research, library and information sciences, federal government, patients and caregivers as well. And so we wanted everyone to have some sense of commonality here. So we were lucky enough to have some members from federal government perspectives give us some brief framing remarks at the start of each day. We had Don Rucker from the Office of the National Coordinator talk about current challenges, realizing the value of the data that's collected in electronic health records and the increased access that we're starting to see to those data, particularly for patients. And in particular, he talked about the challenges around using data in large scale, in population level analysis and really learning from that. Dr. Patty Brennan, the director of the National Library of Medicine, spoke about the NLM mission to deliver biomedical data and information to scientists, healthcare providers, and the public, plus the ongoing shift to data-powered research and this growing base of consumers that want to engage with data and knowledge and receive this in various changing and non-traditional formats. She also connected the MCBK movement, the Mobilizing Computable Biomedical Knowledge movement that we're talking about here today, into that connection with the NLM strategic plan to accelerate health discoveries and disseminate knowledge. And finally, we had Eric Dishman, who is the director of the All of Us Research Program, which is a national program of at least 1 million U.S. participants funded by NIH to advance precision medicine. And Dr. Dishman described the goals of the program, including the need to leverage technology to identify and engage diverse and often underrepresented individuals in research to advance our understanding of health and disease nationally and globally. And he shared his experience as a patient and really reinforced the need for sharing and disseminating this health-related knowledge. So we were lucky to have those framing remarks. And then we also provided a manifesto with some very brief background information, which I'll describe in just a moment, and a reactor panel. So a little bit of presentation and discussion around some common principles for mobilizing computable biomedical knowledge that we sent out to the group ahead of time to sort of prepare them for this discussion. And then we had a panel where we asked a number of key stakeholders and activists in the field to describe the state of the art for using computable biomedical knowledge. We had a poster session, which was very lively, some system demos and reception so we could encourage discussion. And then we dedicated a good amount of this meeting to active discussions in smaller theme-based breakout groups. So I'll describe those groups shortly. And each group was charged to really identify priorities and begin to develop some action plans. And then we had components of the program each day that involved a report and synthesis of these breakout group discussions, because as you'll see in a moment, there's certainly an incredible amount of overlap in content and issues across the groups. And then we offered an open mic session, which I thought really added a great dynamic to it. It really allowed us to be sort of open to new possibilities that for direction and topics that our planning committee might not have thought of. And so this allowed anyone in the audience to share their thoughts, and we kept them brief, but we did have a lot of participation that way. And then we developed a summary and next steps statement fairly on the fly at the end of the meeting, just to give us a mini action plan moving forward, if you will. So I'll describe a little bit of the manifesto, and I encourage everyone on the call to have a look at that. There's a direct link here, which you'll have on the slides after the webinar, or you could get it on our website at mobilizecbk.org. I show you this not to force you to read it on screen, but just to highlight that it is 2 pages. It's 2 pages with a fair amount of white space as well, but really, highlight some key points here. That knowledge has the potential to improve healthcare and the health of individuals and populations, and that every decision affecting health should be informed by the best available knowledge. We felt it was important to have some of the vision that Chuck described earlier clearly articulated and shared with the group ahead of time, so we could all be on some level of common ground. What we did with the manifesto, with the help again and guidance of our wonderful meeting planning committee, we pulled this together through a number of drafts, sent it to people that registered for the meeting several weeks prior to the meeting, asked them to look at it, give us feedback. We collected that feedback, again, worked together as a committee to address that feedback and create a revised version of this, which we then sent to all the participants of the meeting in advance and posted it on the website. And indeed, until recently, that version was on the website. We've since had another public call for comments on this, and so the document that you'll see on the website is slightly updated from what we presented at the meeting, but very similar in spirit. So a couple key points that are covered in this 2-page manifesto that I invite you to read are listed here. Most importantly, mobilizing biomedical knowledge for action toward improving health is really the fundamental vision and motivating factor of this community. We want to ensure that the knowledge properly reflects the best and most current evidence and science, and create a community that we can develop an ecosystem that will ensure the safe and effective use of CBK, and make sure that this ecosystem can evolve with open standards and these fair principles for knowledge that Chuck had described earlier. And then we want to be sure that we can ensure methods to expose transparency and the currency, validity, and provenance of CBK. And we certainly want to create an ecosystem here that is sensitive to the fact that there are many health disparities now, and that this knowledge needs to be accessible by all. And we want that to be a very specific part of our charge, so that's very clearly articulated in the manifesto. So participants of the meeting were given that manifesto. Part of the meeting did summarize that and have a little bit of discussion about it, but we really, the meeting was not about wordsmithing and discussing that. That was really meant to be a starting off point. And then participants in the meeting self-selected into one of 4 breakout groups that our planning committee, over a series of many months of calls, sort of settled down on these 4 areas that would be good topics for breakout groups. But certainly, as we'll see, there's overlap between topics. We identified co-chairs for the meeting for each of these different groups that are listed here. We had the standards for mobilizing CBK group, which is obviously to focus on identifying areas where standards need to be developed or promoted or adopted in order to support the MCBK mission. The technical infrastructure group is really about defining the infrastructure components necessary for CBK to support learning health systems that can move knowledge to practice and evaluate its impact. And as the name implies, is really focusing on these technical and other resources that will facilitate that. The sustainability for mobilization and inclusion group is really was focused on identifying who the stakeholders are that are important to this community, including those that weren't in the room. We really recognize that we only had 150 people there, and there are certainly many more perspectives and folks to engage. So this group will continue, and this will certainly continue to be part of its mission to identify who the stakeholders are and make sure that their voices and perspectives are included. And finally, the policy and coordination to ensure quality and trust group was really focused on identifying different gaps in policy and issues that are required to ensure quality and trust. I'll give you one slide on each group just of highlights of where they landed. So there were several hours of discussion over the course of 2 days in each of these two groups. And as you can imagine, there's lots of ways to approach topics as big and multifaceted as this. So this is where the group landed, and then we are looking forward to presenting what we think will be next steps. But at the end of the 2 days of discussion, the standards group, and each of these groups I should mention probably had around 30 to 40 people, no more than that, over the course of the 2 days. The standards groups really focus on metadata for describing the important dimensions of computable biomedical knowledge. And the action plan, if you will, that the group left with is to work on developing a spanning set of use cases and knowledge sharing scenarios that can then inform the types of metadata that will be needed to ensure all the objectives that we outlined in our vision earlier. And this group certainly recognizes that there are many existing metadata standards and models that can be used for this. So this will be part of the charge moving forward to flesh that out. The technical infrastructure group, again, after a number of days of discussion in a lot of different areas, I think this group actually broke up into smaller groups looking at the generation of computable biomedical knowledge and the encoding and storage of CBK and the use and the revision and the different technical requirements for each of those sort of activities. But in the end, they decided that their action plan would include collaborating with and harmonizing different knowledge users, describing use cases and activity models that will help inform what are the infrastructure requirements for this. Can we identify some reference implementations that highlight these important features? And the group will promote standards as services and keep an eye on minimizing the number of standards that are required. And this technical infrastructure group will continue to define sort of the higher level features about knowledge and its use and learn from other industries as it explores these topics. The Sustainability for Mobilization and Inclusion group is really focused on identifying the value of CBK and maximizing the impact that it can have on a variety of stakeholders. They wanted to articulate value propositions for CBK, but understand that different stakeholders and communities obviously will have a different value proposition there. And so crafting narratives around the importance of this will be something that this group can work on. And key stakeholders identified, at least to begin with, are certainly the professional societies, patient advocacy groups, organizations that are developing clinical practice guidelines, libraries, and certainly industry vendors. And then our final group was the policy and coordination to ensure quality and trust. And there's a lot of content and issues that fall under the purview of this group. The driving question for this group and their discussions over the course of 2 days were really, what is the process for ensuring high quality and trustworthy knowledge in a CBK ecosystem? And so they focused on trying to define and convey transparency in the system, and thought it would be useful to understand practices from other groups and compare the metadata schema for representing those features from other groups, and to evaluate FAIR systems for transparency, and also to extend the FAIR concept to include traceability, licensure, and connectedness. And this is an extension that Melissa Heindel and others from the Monarch Initiative and the CTSA consortium have endorsed. So there's clearly a role for that here in a CBK ecosystem. And this group also talked about, again, the metadata that would need to be defined to ensure this transparency, and asserted that all information and metadata about CBK that would inform users about how to apply it in specific cases needs to be clearly defined. Limitations and derivatives need to be defined, and that somehow we should be able to identify conflicts of interest and explicit values and trade-offs and limitations and things related to any piece of any CBK artifact. And as I wrap up here and open us up for discussion, I hope people are thinking about questions or comments that they might want to share with the group. I'll summarize here with decisions that were made at the meeting. So after these 2 days, the framing remarks that I discussed, the work of the 4 breakout groups are sort of social time and time on the program for interacting and crosstalk between the groups. We did actually come up with some decisions despite the large and diverse crowd. There was a widespread agreement to continue this effort that is important and that we could advance the mobilizing computable biomedical knowledge agenda, and that we should do this primarily through the continuation of those 4 theme-based work groups that I mentioned. We thought it was vitally important to develop a supportive infrastructure, so we needed a website, and communication and outreach plans. We thought it was important to create a webinar series, again, part of that outreach to share this information with people that couldn't attend that meeting last July. And then we wanted to continue this effort, and we thought a face-to-face meeting would be appropriate, and that a year's time would be a good time. It would give us hopefully some time to make traction within the 4 work groups and be able to come together. So tentatively, we agreed that a meeting in the summer of 2019 would be good. And then in terms of governance, the meeting planning committee agreed, it was suggested, and they all agreed to move toward the new title of steering committee for this MCBK effort moving forward. And University of Michigan has greatly offered to be the interim home and research hub for this. So they've helped with some of the administrative duties and building the website and communications and that type of thing. Moving forward, as I mentioned, these 4 theme-based work groups will continue the work and address some of the issues that I mentioned were discussed at the close of the July conference. So we'll have the standards group, the technical infrastructure group, sustainability for mobilization and inclusion, and the policy and coordination to ensure quality and trust. And I'm pausing on this slide because I'm hoping that you're listening and thinking which group you might like to join and follow and hopefully contribute the discussion toward. And finally, I will encourage you, and on behalf of me and Chuck, to really get involved with this. His team has put together a great website for us. It's mobilizecbk.org, and it's a starting point. We can put materials from the meeting. There's background materials. The manifesto is there, and as we move forward, it'll be a place that we can facilitate discussion and dissemination of information. You can always email us directly, and operators are standing by. We are really happy to hear from people and want to grow this as much as we can. Another way to reach out to us is to complete the survey, which we will send shortly. There'll be a link posted in the chat box very soon that you could follow. Very brief survey, and it'll enable you to sign up for a group, share a comment or question, or let us know how you want to be engaged or any concerns that you have. We ask you to stay tuned for future webinars. Our vision is that this is the first in a series of webinars, and that the future webinars will actually be driven by the agenda and the action plans of the working groups. So we're planning for one in early December, and we'll send you that information as soon as we have it. Everyone that registered to this webinar, we've got your email, so you're now on our list, and we will share to similar lists as we did to advertise the 2018 meeting. If people have ideas for outreach or groups that we should be sure to connect with, then please do send us that information as well. And then mark your calendars. It's not official, but we are 99% sure on this date and of a meeting for July 18th and 19th in the Bethesda area. We will finalize and notify you of details as soon as we have them. And I think I will just move it now. We'll start moving into a Q&A session. And we've got all the information here on this slide. As Chuck mentioned at the start, we're going to try and keep this efficient, so for the sake of time, we'll keep the audience muted, and we'll ask you to send your questions through the chat pod. We'll address as many as we can that we think are of broadest interest, and then we can certainly follow up with you afterward. So with that, I think I'll ask Chuck to unmute yourself, and maybe we've got a few questions, so I'll just quickly look and see if there's one I can start with here. Let's see, open source and its central repositories. GitHub is an example of successful general computable knowledge sharing. Are there lessons to learn from that community? Thank you, Steve Johnson, for that comment and question. Yes, I think there are many examples of people sharing knowledge, and we want to sort of identify everybody that's got some relevant experience in this space and learn from them to the best that we can. And certainly GitHub is an example. I think what comes to mind immediately for me is that is a sort of low barrier way of sharing. It's fairly easy to share because there's not a lot of restrictions in terms of, say, metadata and required elements and formatting and layout and that kind of thing. So, but as we've identified from the work plans of the other groups, I think it's very important that CBK contain metadata that helps us understand its history, its provenance, its quality, its appropriateness for certain situations. And so likely there's going to be some work involved for people to share. But I think the first lesson learned that I could see is something that's open, and we want to limit the barriers as much as possible and make it easy for folks to share. Great question. Chuck, there's another, I don't know if you're unmuted yet.
I'm unmuted.
Oh, yeah. Do you want to address? There's a question in here about moving forward with funding and IP.
Yep. Yeah, I had my eyes fixed on that one.
Yeah.
The question was, can you address how this? Whoops, it's scrolling automatically. I just lost it. Can you address how this effort is funded? How issues of IP access, confidentiality will be addressed. I guess my overall answer to that question is I wish I could, with great specificity at this point, address all of these things, especially how this effort will be funded. My best answer to this question, and not trying to be jocular or evasive, is that these are all things we are going to have to figure out. I'm delighted to place at the disposal of this community to help it get started some modest funds that are available to me in my role at the university, but that clearly isn't going to get us anywhere near where we need to end up if, in fact, this is going to become some kind of universal movement for health infrastructure. So I think this question really goes to some of the first activities that this community that we are trying to assemble has to collectively address. We're going to think very hard about how to obtain funding. Clearly, we are hoping to engage foundations and other sources of funding who might take interest in this. We are also envisioning accepting donations and trying to put in place a mechanism for that. We believe that the value of this is self-evident, and that this is indeed where things need to go, and we're hoping this will motivate not only philanthropic organizations and I dare say government agencies as well as organizations in the health sector and even individuals to make resources available to this. So that's obviously going to be very high priority for us, and I think the question also addresses the agenda for the agenda for the early work of the committee. IP is very much on the radar screen of the policy group as are issues related to access and confidentiality. So I invite the person who placed this question to join that group and get involved. Rachel, take the next question.
Yeah, terrific. The next two, I see two that are in my wheelhouse and related. One, we have a question: how does the concept of executability come into these plans? This MCBK has to make it to the point of care somehow, and that's a great point. I think, as Chuck, you mentioned in your background, I mean, clinical decision support is a driving use case for this. Not the only use case, but certainly a very important one. And the idea is to get executable knowledge, just as this listener pointed out, to the point of care. And so that is really our vision here, that we are providing metadata, supporting information infrastructure to make that happen. We do recognize, though, that there's not a lot of that out there. There's not a lot of fully executable decision support out there for a number of reasons, not least of which is lack of standards. So part of our vision, and it's articulated in the manifesto, is that that this ecosystem will evolve, and that we should be prepared to evolve, and that at early stages, or maybe in any stage, we be prepared to accept knowledge in any format, or formats that are not quite computable, but getting there. So in the case of decision support, there's a range from human readable to machine executable, and so different programs or applications along that spectrum would certainly be things that we want to be able to address and handle, in particular decision support rules and things that are semi-structured or partially executable, I'll say. So this is certainly our vision to facilitate the automated use and application of executable knowledge, but we recognize that it'll take us some time to get there. The next.
Rachel, could I jump in on top of that?
Yeah.
Yeah, so I saw this question in a complementary way to your answer. I think it would be a fair criticism of my abbreviated presentation to say that I might have left the impression that the ecosystem would consist of computable knowledge sitting in libraries that perhaps nobody would ever use. And I didn't mean to leave that impression. I think just as libraries have patrons who access the knowledge and put it to use, I should have added to my presentation the all-important concept of what we locally here call activation, that this computable knowledge will only realize its full value if, as part of this ecosystem, there exists infrastructure to put this knowledge to use. One scenario of many for which would be to instantiate these models with data and use them to generate advice or other messages that inform decisions and choices at the point of care. So I think one spirit of this question was, hey, you left out activation, and I think I really am pleased that that question was asked, because this point needed to be made as well. Rachel, do you want to pick another question?
Terrific. Thank you. Yeah, there's one sitting here that I'm just dying to address, and I could do it very briefly. The question is the scope of CBK inclusive of defining the data required to compute knowledge? For example, what are all the data points needed on a patient to make a recommendation about treating a specific disease? That's a big obstacle to decision support today, and I fully agree. And to answer the question, yes, it would certainly include this, and this sort of the mechanics of this and how to make that happen is a topic that was actively discussed with the standards working group at the meeting, and will continue to be. So as I mentioned, the standards group is really focused on defining structured metadata for CBK artifacts, including decision support or phenotype definitions that would feed into decision support. And so these dimensions could actually include the use, inputs and outputs, and in particular inputs from electronic health record data, and the challenge of lack of standards for large pieces of that is one of the challenges that complicates this. But certainly to fulfill our vision of making these executable objects, executable, and to be able to activate them, part of that information includes, what are the inputs of that. So certainly this is within scope, and if this topic interests you, please do consider joining or following the standards group.
Rachel, let me pick up on a question from one of my favorite colleagues from the UK, Philip Scott, who asked about the extent to which we see this as a U.S. initiative or a global movement. And I just want to be very clear that nothing about this movement is coterminous with the boundaries of the United States of America. Clearly, we envision this as a global movement. It's kind of starting here. For whatever reason, although we know there are people in other countries around the world thinking about these same problems, we are going to issue a broad and open invitation to our colleagues from around the world to both join us at the July 2019 meeting and participate on these working groups. So this is a global invitation, not just an American invitation. Thank you, Philip, for that question. Rachel, I think we have time for one more quick one. Can you take that?
Yeah, that'd be great. And I'll just mention there's a few more about detailed standards initiatives and our cooperation with them. So I will note those and get back to the to those that submitted those. And the answer is yes. We're interested in engaging with any relevant standards. But I think a great question to end on is this one here, which asks about ideas about what the structure of the July 2019 meeting will be. Will there be an opportunity to submit papers, posters, panel proposals, etc.? Thank you. That's a great question to end on. We don't know exactly. We'll have a planning committee, and our steering committee for the movement will certainly be very engaged in that. But I feel very comfortable in saying that it will be very, very interactive, and we want to engage others. So this time our poster session we had capacity for about 20 posters. We hit that capacity and actually had to turn a few away. So that was very successful. So we'd want to continue that. The idea of papers or panel proposals we hadn't thought about, but I think it's fair to say we would happily consider those in other ways that we could engage people. And then we would certainly have an aspect that would be a working meeting so that these work groups could continue. That's what I envision. And Chuck, I don't know if you want to add to that or just give a summary, sort of closing statement, and goodbye to this webinar as we get near the top of the hour.
Yeah, thanks, Rachel. I think we do have to close. I do want to amend my earlier statement about how we're going to respond to these questions. Scrolling through these questions, I see that really all of them are of general interest. So rather than get back to you with individually with a response, although we may do that in some cases, I think what we're going to do is create a public response to the full set of questions that have been asked but not yet responded to, and put that on the website and send you all a link to that on the website, in effect creating a kind of FAQ. Thank you for these great questions. Thank you for attending the webinar. We hope you found it useful. Please get involved. We want this to be an extremely inclusive process. Many of you in your questions and comments pointed to resources that are already out there doing things relevant to this movement, and we really want to be sure that we incorporate and make best use of all of the great relevant work that has already been done in the world, and advance our progress, accelerate our progress thereby. So thank you. Be in touch with us. And again, we really appreciate your joining us today. Stay tuned for the announcement of the next webinar, which we expect will take place in December, and we look forward to being with you again at that time. Thank you again. Rachel, anything you want to say in closing?
Nope. I actually do the survey. If people get the link, please fill out the survey. And thank you so much. Have a great afternoon, everyone.
Okay. Bye-bye, everyone.